Hi, I'm your host, Marsha Florence with Just Ask. Today's show, ladies and gentlemen, is Understanding the Social Security and the Medicare Maze. Hurry back and join us. Hi, I'm your host, Marsha Florence with Just Ask. Today's show, ladies and gentlemen, is Understanding the Social Security and Medicare Maze, and we have some wonderful returning guests who's going to tell us that. So today we have with us the president himself, John Becker, Advocate Financial, and Rodney Ross, co-founder of Ross Insurance Group. Good afternoon, gentlemen.
It's great to be here, Marcia.
Thank you.
How you doing?
Thank you so
Good to
much
be
for
back.
coming back. That's what I want to say, coming back.
Did the year go fast or what?
Oh, please. Now we're into the fall season already, okay? Okay. Now, gentlemen, last time you were here, we had the chance to introduce you to our viewers about your program, well, Social Security and definitely Medicare and information. So this year is something totally new, okay? So tell us a little bit about yourself again, John. Fill us in, and your role as the president.
Yeah, my role is I am co-founder with my son Benjamin in Fort Wayne, Indiana, a national firm that helps folks around the country become experts on Medicare and on Social Security issues, because many Americans don't understand all the benefits they can get. So our role is to help people get more benefits out of Medicare and Social Security so they have more money in their pockets and they're living healthier lives.
Okay, wonderful, wonderful. Now, Rodney, fill us in on your role here.
Well, I am the co-founder and the managing partner of Ross Insurance Group Advantage. And we here in Michigan, we provide Medicare services. We are an advocate for persons that are on Medicare, and we help them to understand what their Medicare needs are. And again, as it says, we help people understand the maze that is Medicare as well as Social Security. Both of those are benefits that our citizens are entitled to. However, they are they're just misunderstood. People don't know how to access them, and people don't understand them. And our goal is to just help people, to guide them along and serve as their advocate to help them.
That's great. That's great. Now, we know it's almost that time, open enrollment period, Medicare open enrollment period. So fill us in, what does that really mean?
Well, basically, it means that the federal government mandates that every October 1st through December 7th, every American has the opportunity to look at their Medicare plans and decide if they need to make a change. And it's guaranteed issue. There's no health requirements. And Rodney and I have been studying the changes for 2025, because whatever we do in this Medicare open enrollment period will affect the plans that go in effect for each American on January 1st. And this is going to be the most dramatic market we've ever seen, isn't it, Rodney?
Absolutely, for sure. Medicare, they have just made a lot of significant changes to the overall Medicare program, to the extent that there are changes that are being implemented that agents aren't even aware of, and the carriers are still struggling with some of these changes. So this year is really going to be quite a challenge for people to make a decision about to keep what they've got, to make a change. The most significant thing is that this year is really the most significant year that people find a Medicare advocate that they can call, that they can talk to, that will sit down with them, that they can trust.
Now, you know, that's easily being said than done, because, you know, the phones are going to start ringing sooner or later, and all the different, you know, representatives from various different healthcare organizations are going to be calling people. How will someone know what to ask for? How will they know if they got the right one?
Well, I think the key thing is hopefully you have a Medicare agent. If you don't, one of the wonderful things about our firm is we have agents throughout the country that can help you. And to become an agent, the requirement is you have to take a test every year called AHIP to make sure you're proficient on what Medicare can do for you. And you have to get a 90% passing grade. And if you can't do it 3 times, you lose the right to help people on Medicare. And you need to sit down with the agent that's local, because allowing someone to make changes over the phone will not give you the full benefit of all the changes that you're going to get. And Rodney and I know that this September, the last 2 weeks of the month, every American is going to get the notice of change. And please, we recommend you look at those changes, because we see costs going up and we see plans making significant changes that's going to affect everybody's pocketbook. And one of the reasons why is because of the new act that was passed, wasn't it, Rodney?
Correct.
So what was that new act all about?
That was the Reduction Act, the Income Reduction Act. And what that did, that impacted the Inflation Reduction Act. It impacted the cost of Medicare drugs. And that act went into play for 2024. Some of the carriers are still struggling with putting the components of that act in place. So just trying to explain to the Medicare beneficiaries the new changes, how it's going to affect them individually and their out-of-pocket cost, is really going to be quite a challenge. And the last thing that a person needs to do is talk to someone on the 800 number who's really just trying to fill in a quota.
Right.
They're not concerned about the human being they're talking to. They're concerned about meeting their monthly goal for closing a case.
You know, and that's I mean, that's been the ongoing situation for years. That, you know, representatives call and say, hey, I can take care of all your information over the phone. You get a letter in the mail, you get your cards in the mail. And people get excited when they hear that they can get groceries or they can get their transportation. They get excited, but they don't realize that there's some components behind those gifts.
You're right about that, Marcia. And what I'll use the word, what I educate our clients to do is to call us when they see these commercials, because I explain to them, the big print giveth. And there's a little tiny, teeny weeny print at the bottom of the screen that tells you, if you could read it, that doesn't apply to me. I can't get that. But, you know, they answer the phone, unfortunately, and they let people keep them on the phone for an ungodly amount of time, taking information, and then the person is enrolled into something that doesn't serve them well. When I talk in front of groups, I say this to them. There are 3 things that seniors on Medicare should not do. Thing number 1, do not enroll into a Medicare plan from an 800 phone call. Thing number 2, do not go on the internet and enroll into a Medicare plan or anything else. Thing number 3, don't forget thing 1 and thing 2.
Okay. Okay, well, that was well said. Well, I tell you, I mean, you know what, just saying that alone, Rodney, makes a lot of sense, and I hope our viewers today will take heed to that, because some people are going to say, well, what you want me to do? I have no idea of how to become enrolled in the program or change my program. So I tell you what, we're going to take a break, and we're going to come right back with some more good information about understanding Social Security and the Medicare maze. We'll be right back.
If you store your guns properly,
I'll feel safer when I'm playing outside.
Safer when walking home.
And I won't have to tell my kids, this isn't a drill.
Never let your gun get into the wrong hands. Always lock it up.
And welcome back. Now, ladies and gentlemen, you know how I always tell you, get your pen and paper out. Why? Because you probably have questions that you need answered right before you get into this deep-rooted situation of enrolling for your new coverage. Now, you'll see the numbers at the bottom of the screen, or you can call our number, 1-800-323-5336, or email me at marcia@JustAskTalkShow. So John Becker and Rodney Ross information will be in the credit rolls as well as you can see that at the bottom of the screen if you need to talk to these gentlemen directly, and I would suggest that you do. Now, gentlemen, I wanted to say that because the new uniqueness about your program is that you actually attach yourself to the person so they have a better and clear understanding of how to make their selection and what's involved in the selection process. And even after they made that selection, they can reach out to you and talk to you directly or talk to the staff and not be intimidated. Sometimes when they're dealing with these other agents, unfortunately, like you said, it's like a robot call. You get this call, somebody talk to you, they sound very kind-hearted and considerate, and then in the end, when I get ready to use particular insurance, something's missing. Okay, I get my prescription coverage. Something is missing. I'm like, well, the person on the phone told me, and who's that person on the phone? I don't know, but
Right.
we go through all this. So I admire the fact that you gentlemen, are doing a hands-on job. But I had a question. In this new period of enrollment, how will prescriptions coverage be affected?
Yeah, one of the things that Congress has done, Marcia, that's going to affect everyone is prescription drug costs. They're going to be a lid of $2,000, and they're going to increase deductibles and copays. So every American is going to spend more money on their premiums and copays. And that's one of the reasons why we think that there's going to be a substantial amount of folks, more than ever before, that want to sit down, because this is going to be one of the most dramatic annual enrollment periods we've ever seen. And Rodney and I have been in the business for over 20 years. And every person on Medicare should sit down with a qualified agent and look at their needs. Every plan has a niche. Some plans will provide better dental care. Some plans will provide better hearing care. Some will have food benefits. Some will have utility benefits. Some of them will even have Part B givebacks. In other words, they'll give you $150 more a month in your Social Security check by enrolling in that plan. So you need to look over your plan and compare what your needs are in 2025. But I can promise you, what Rodney and I see in the industry is that every American will want to sit down and look at what the changes are, because we're all going to be affected, because right now the Medicare is going to pay less to the folks in benefits.
Okay, so let me say this. A person decides they're too fearful to change right now between the month of October and December. So what happens in January?
They have
Well-
another period.
Well, for those persons that have a Medicare Advantage plan, in January, from January 1st to March 31st, they will get a second opportunity. Now, persons that do not decide to enroll in a Medicare Advantage plan when December 7th ends, it's a wrap for them, unless they have some extenuating circumstances throughout the course of the year that makes them eligible. But other than that, it's a wrap. A comment I want to make, and this is going to sound pretty self-serving, but it's accurate. When the person enrolls with a 1-800 number, they have no idea where the person is, who the person is, how they're going to get help when their prescription drug part doesn't work. When you enroll with and consult with our team, you have a person, us, that you know where to find us. We come to you. So we're not talking to you on the telephone, and we're not keeping you there just listening while we read to you and at you. We bring literature, we bring information, and we provide you with the ability to make a good decision. I always say this. When a person enrolls in a Medicare plan, you can ask them, hey, what made you select that plan? Two possible answers. One is not a great answer, one's a real good answer. Here's the two possible answers. Well, I was talking to this person, this guy on the phone, and he said this was a good plan to enroll in. So I did.
Okay.
That I call not a good answer. Now here's the good answer. Well, I sat down with Mike, and Mike, he came to my house, he sat down, he brought the literature with me, we read the books, he explained the benefits, he showed me how much it's going to cost me out of my pocket, and then I decided that that's a good plan for me.
Okay.
Now, that's a good answer.
Okay. All right.
And that's our goal for everyone that we work with, for them to be able to give a good answer about why they made the decision that they made. We call it empowerment.
And that's
Great.
especially, Rodney, when it comes to prescription drugs. Each plan have their niches. One drug, prescription drug, will be more with Plan A, and less with Plan B. So one of the things that we do is we check out the doctors, we check out the prescription drugs that you're taking, and see which is the plan that's going to be less expensive for you. That's another reason why you need the agent, is to sit down and make sure your needs are met, because every plan has a niche. And is that niche going to serve you?
I mean, I just look at, like, you know, for our senior population, someone is aging and they're probably fearful to, you know, make a change, and they're not sure. So hopefully today, like, we'll get this message across to our elderly population to better serve them, as well as our disabled population. But I did have a question about, what is a Social Security analyst? You guys have an analyst involved in your program?
So that's a designation, and it's a registered Social Security analyst. And that is a person that has gone through training and taken a 4-hour exam that was a practical exam, as well as case studies in which we had to be able to demonstrate knowledge of the Social Security system, knowledge of how to interpret the information, and how to understand the various benefits and options that are available to people for making a decision about taking their Social Security benefits. That's one of the areas of just huge misunderstanding and lack of clarity by Americans. And we're all entitled to, you pay into the system, but when it's time to make a decision, there's no one other than a registered analyst that can answer the question and guide you to the correct answer. If you call Social Security, they have information, but their people will tell you on the phone, I can't give you any advice.
Right.
They can just, give you information.
They can't help you.
Right.
Strategize. And also, if you don't ask for benefits, you won't receive benefits of Social Security. Let me give you an example. We just did a roadmap, we call Social Security roadmap for someone. We have an older gentleman. He and his wife inherited some new children from their kids. And now Grandma and Grandpa are now the parents of a 3-year-old and a 5-year-old daughter. And it's wonderful. And they didn't realize that Social Security will pay them $6,000 a year for being parents. Now, once the grandfather gets 67, $26,000 a year will be paid for dependent benefits. He didn't know that. He wouldn't know it until he talked to one of our analysts. So the great thing about working with us, we're going to make sure you get the most out of Social Security, because if you don't know the rules, you're going to miss out on the benefits.
Oh, yeah. Oh, yeah. Oh, yeah. Well, I tell you what, gentlemen, we're going to go to a break. Ladies and gentlemen, I don't know about you, but I'm learning a lot today. So we'll be back to get some more information. We'll be right back.
This isn't a workout video. It's about how LLS has helped blood cancer patients like me thrive, and how your donation can help countless others. Please give today at lls.org.
Now, ladies and gentlemen, like I said, get your pens and paper out. This has been a very, very resourceful show today. And we're definitely going to have John Becker and Rodney Ross back again. But you know what? This is their 3rd time visiting us, and that means that something's good coming down the pipes for you to learn about. So the time that Rodney came to see us was understanding the Medicare maze. Now today is the Social Security and Medicare maze, all right? So, ladies and gentlemen, a lot of you are going through that age and stage where you're becoming eligible for Social Security. You have a lot of questions. Gentlemen, you know, a lot of people don't realize if you don't ask, you don't know, or you don't ask, you won't get the answer you need. So, you know, do you have some scenarios where people should automatically know to ask these things, or they don't ask? What do you guys offer to do?
Well, basically, if you are married, widow at age 60 or older, and your spouse, your husband, dies when he was on Social Security, you can start getting benefits at age 60 as a widow who has a husband that unfortunately died who was on Social Security. The other thing is, if you are on Social Security and you have any dependent children under the age of 19, you can also get dependent benefits. And we help one gentleman, his wife is on Social Security disability. They have now 2 grandchildren that they're responsible for, they're guardians for, one's 3 and one's 6. They can get $6,000 a year in dependent benefits. Now, once the grandfather is 67, they'll get $26,000 a year on dependent benefits until the youngest is age 19.
19, okay.
If you don't ask the Social Security for these benefits, you will not receive them. Social Security will not come to you and say, we have these benefits for you. You're going to have to go there and enroll. And that's one of the reasons why Rodney and I are registered Social Security analysts, because Rodney can do a roadmap, because like Rodney said to me, everyone's different. Right, Rodney?
Correct, right. Everyone's situation is different. And the roadmap that we put together is based upon a person's specific situation, what their earnings have been, what their income is expected to be going forward, and the various categories that they may be eligible for benefits. And we document it. It's like a financial planner document that they would get. It's a full-fledged document that we put together for them, and we also review it with them, and we provide an annual checkup each year.
Okay.
So we come back and revisit what the last year was like, and have there been any changes that need to be accounted for in the current year?
Now, you know, I understand. Well, I'm going to tell you this. That's why the name of the show is Just Ask. Because if you don't ask, you don't know. So we just ask you to just ask us, okay? That makes a lot of sense that people say, I wish I could get more money. I have these kids and I don't know what to, do. I try to ask social service for benefits and they say, oh no, we're not in charge of that, and I don't get anything. But if you are the grandparents of a adult child who had children and that child is missing in action or is deceased, you've taken over that right to raise those children as the legal guardian. There is a ton of benefits that the grandparents are eligible for, but they just don't know. And starting with the Social Security benefits is at the top of the line.
Yes, and because they were, in their 60s, they didn't realize when they took on these children that now they have these extra benefits. So the age group that on Social Security you really should sit down is start looking at your Social Security benefits at 60, because when you're 62 you can take it, and a lot of Americans make a mistake of taking it too early, and you can lose up to 54% of benefits. And we had one situation, a 62-year-old gentleman had a lot of assets and he was going to take Social Security because he didn't want to work and have earned income. But by not waiting till 67, he was going to lose $600 a month for the rest of his life. And over the next 20 years, that's a lot of money. So we did a plan for him, a roadmap, and showed him. So he's now going to wait because he has enough assets to carry him from 62 to 67. And that's what Rodney and I do for people.
But there is some flexibility if a person sustains an injury and they're getting Social Security disability.
Yeah, and that can help you get more benefits for your dependents if you ask. And Social Security will not give you a plan. They will only enroll you in what you ask for.
Well, you know what? Everybody, I shouldn't say everybody, but majority of the government agencies are designed like that. If you don't ask for it, we don't know anything about it. We're not asking to put something else down on paper, but if you mention it, now I got to address that.
Right.
Okay? Because it's more understanding if the person knows what they want versus what I'm suggesting that you want.
And it's also knowing to ask the right question.
Correct.
Yes.
Because when you call someplace, you ask them the question that you know to ask, and they'll answer that question.
That question only.
And that may not actually tell you what you need to know.
And Rodney is going to put on Social Security workshops.
Oh, great.
So that people can understand what is going on and what are the key points they need to look at, and how we can do a roadmap for them. And we will get those dates. We're just setting them up right now for the months coming up and starting
Let us know.
at the tail end of September and October, where we can sit down and talk to people about their benefits. So anyone between 60 and 70 should sit down, especially if you have a younger spouse, and look at them. And
have a
divorce
roadmap.
Women, if you've been married 10 years or longer with someone, you might be able to tap in their Social Security benefits.
No, you didn't tell us that. Okay, now.
So,
Okay, you didn't say that, but okay.
So that's another
Okay.
thing you need to look at.
Okay.
Because, you know, some folks are divorced, they've maybe been married 10 years, maybe the Social Security benefits are higher from your spouse's benefits than they are from your benefits. So let's tap into them.
Well, okay. I didn't say that, ladies and gentlemen. He did.
Marcia,
But go-
one last thing about the seminars. If they go to our website, they can find the dates for the Social Security seminars that we're going to be holding.
Okay, okay, we'll have all that information
And
available.
there's no cost, too,
Now,
Marcia.
I just wanted to say something. You know, I'm impressed with something. I shouldn't say I'm impressed, but I appreciate you guys doing this. So I have this brochure. Well, it's not brochure, but anyhow, I have this fax information. Understanding the Medicare Maze, your local independent agent, Rodney Ross. Now, ladies and gentlemen, I know if you can see this, you're saying, what's the big deal, Marcia? The big deal is that it's in Braille. Okay, so I know the cameraman can't see that, camerawoman can't see it, but it's in Braille, and I am just honored to know that you guys have opened the doors to assist our visually impaired friends and
And
families.
also deaf, too.
Yeah. Okay. So
We work with the deaf community
Okay.
because it's underserved. They need someone that can help them with the communication hurdles. And that's why Rodney and I are both involved with the American Medicare Disability Advocates, too. And that's the emblem there, because we want to serve the underserved.
Well, I am so honored, and I'm sure that our friends who have family members that are hearing impaired, profoundly deaf, as well as visually impaired would be honored to know that you guys have done this and will be calling you. So, okay, ladies and gentlemen, like I said, this information will be in the credit roll, so don't panic if you can't get the number right here in my hand. All right, well, gentlemen, you know, is there anything else that we need to say before we wrap up here? Because I'm going to ask you, will you come back again and see me?
We would love to.
Okay.
When you want to do it.
Okay.
Yeah, what's next? We love talking with you, Marcia, because we can help so many people. And it's great to have a resource that you provide to the public. So thank you for the service you're giving the community. And we're here to help people. And I'm having a lot of fun helping people throughout the country. And every area of the country is different. And so if you move to Florida, Arizona, or any other place to hang out with your grandchildren in Texas, for instance, the plans are different there, and we'll help you anywhere nationwide, your family get the plans you deserve.
Wonderful, wonderful, wonderful. Well, gentlemen, Rodney, you got any last words you want to tell us?
Call us. Call me.
Yeah, Rodney's
Call me today.
excellent.
Okay, that's
He
well
gets
said.
rave reviews, Marcia. He gets rave reviews.
I bet both of you do. Okay, that's well said. Okay. Well, ladies and gentlemen, you know what? What can I say? These gentlemen came with a plethora of information and resources for you. So go to our bottom of the page, justasktalkshow.org, or email me, Marcia at justasktalkshow, 1-800-323-5336, and get their information in the credit roll if you don't want to even connect with me. But remember now, it's that time of the year you need to make those decisions and make them thoroughly and be calm about it. Don't be rushed. Don't get upset. Reach out and talk to people so that you know exactly what you need and what you want. And remember what Rodney Ross and both John Becker said. Ask the questions. Just ask. I'm your host, Marcia Florence, and what do I always say? If you have a question about a person with a disability or just a general question, don't be afraid to ask. Just ask. I'm your host. Thank you.